Hi, my name is Wendell Miller. I'm the Administrative Manager for Paragon Management Neurological Rehabilitation Program. Today we'll be discussing brain health.
Hi, my name is Ricardo Palomo. I'm the Assistant Neurological Coordinator at Emerge Nursing and Rehabilitation Center. Today we'll be discussing brain health.
What is brain health? When every individual realizes their own abilities on their cognitive, emotional, and behavioral well-being. That is what brain health is the definition of. What are you looking forward to as you age? Most people are looking for good health, retirement, navigate through our environment, travel with our loved ones, spending time with family, making time for our hobbies. So what is brain health? When we look at brain health, we think about four aspects. We think about memory and we think about learning.
We also think about play and concentration.
So part of caring for your brain, we have four areas as we discuss. We discuss the physical activity we need to think about. We need to think about the diet and nutrition. We need to discuss cognitive stimulation and social engagement. These four aspects of your brain areas are important in development, and as we get older, we really need to focus on it. The saying says, use it or lose it. That's what we need to constantly work on as we get older. Physical activity, diet and nutrition is very important, cognitive stimulation, and social engagement. So as we look at the physical activities, a lot of times we tell our patients, they need to do some light exercises when they're home. They could be just raising their hands up and down 5 times, right? We just want to get our range of motion going. We could focus on some breathing exercises like this. So I'm going to put my hand on my stomach, and I'm going to take some deep breath in. I'm going to breathe in, slowly breathe out. Breathe in, slowly breathe out, breathe in, breathe out. You want to relax your mind, you want to relax your shoulders, you want to bring yourself to a nice center, you want to be sitting upright, you want to make sure your posture is correctly there, and you can do some light exercises where you can raise your hips up, nice and slow. Make sure you're in a chair that has an armrest. It can help support you. We don't want you to fall and hurt yourself. So the goal is really to get you to moving. A lot of movement, just nice little reaching, stretching your body, nice little exercise. You're going to breathe in again, breathe out, breathe in and out, and then you really start calming your mind down. You're calming it, you're centering yourself and really concentration on you. The goal is to concentrate on you. Again, we're working on your mind, your body, and your soul, and get you into that moment where you can really focus on who you are. So you're going to breathe in, and you're going to breathe out. You're going to breathe in, and you're going to breathe out. When you're finished with that, we could do another light exercise, where you can just bring your shoulders up and relax. So we're working from your head all the way down to your toes, and relax. Shrug your shoulders. You can do this like 5-10 times. The next thing, you're going to reach out and you're going to say like stop. And that way you're stretching all your extremities, your upper extremities, and relax. You repeat these exercises 5 times. Again, we go down to the legs and then down to the toes. These are just some light activities you can do while you're watching TV, while you're working, you're meeting with your grandkids, things like that you can do to help support your physical activity. Use it or lose it, so we got to keep moving constantly.
In addition to physical health for our brain activities, we can also do cognitive stimulation. I like to have a whiteboard, maybe a piece of paper, anything that you can write on will really help with this activity. What I do here is I'm writing down random letters. With these random letters, I want to challenge myself. Can I come up with a 3-letter word out of these random letters that without repeating letters? A 4-letter word, a 5-letter word, 6 or more? That's up to you. How far can you go with this? With this sequence, I can make the words cat, hold, right. Sequentially, the words are getting bigger. Can you come up with any other words?
What to eat and what to avoid. We look at the Mediterranean diet and have a lot of nuts, seeds, legumes, beans, whole grains. Lean meat and fish is important, fruits, vegetable, and again, olive oil. What to avoid? You want to avoid food like with saturated and trans fat, processed foods, foods that are high in sodium and sugar, deep fried foods, and unhealthy fast food.
To further stimulate cognition, you could do things like learning a new language, reading, learn a new skill, learn a new game, do word puzzles, drive a new way home, or don't use your GPS. Use the other hand to brush your teeth or hair. Embrace new and novel experiences.
Dementia. So we have to talk about dementia because it affects millions of people around the world. Dementia affects 2 or more of the following function of the brain. It affects memory, communication and language, ability to focus and pay attention, reasoning and judgment, visual perception, severe enough to interfere with our daily life. So when we look on the umbrella of dementia, there's different types of dementia. There's Alzheimer's dementia, there's vascular dementia, there's Lewy body dementia, there's mixed dementia, there's frontal temporal lobe dementia, dementia associated with Parkinson. And this is a lot of information I'm giving you. The best person that you would really get all the information and get the knowledge from, I would speak to my neurologist because they're the one who will be diagnosed it. Then you can see a psychologist and you can see a neuropsychological evaluation to help support you.
Alzheimer's. There is currently no cure or way to stop progression of Alzheimer's disease. However, there are steps we can take to modify the experience. Lifestyle factors might reduce or increase a person's risk for dementia. These risks include hearing loss, hypertension, obesity, smoking, depression, lack of physical activity, social isolation, and diabetes.
So when we look at our overall health, overall health may help to maintain good brain health, meaning that we're optimizing our health, we're optimizing our health care. We want to decrease going to the doctors. So we want to really work on stimulating the brain. Again, physical activities. These are the things we need to work on when we say the overall health. The 4 components we said in our previous slides that we need to work on. So as part of Emerge Neurological Rehabilitation Program, we like to talk about FAST. What does FAST mean? It's important to know what FAST means because it can help save a life. FAST, the acronym means F, you're going to look at someone's face. Ask a person to smile. Does one side of the face droop? A, could you raise your arm up? Ask a person to raise both arms. Does one side drop or the other side drops? Speech. Ask a person to repeat a simple phrase. Is the speech slurred or is it strange? Time. Time is important because if you see any of these signs, call 911. Fast means that someone might be having a stroke and you want to be able to act quickly, and if you act within a certain period of time, that you could save that person's life.
At Emerge Nursing and Rehabilitation in Glen Cove, our neurological rehabilitation program includes the following team members: nursing, MD, DO, physiatrists, certified brain injury specialists, physical therapists, occupational therapists, speech-language pathologists, neuropsychologists, psychiatrists, neurologists, dietitians, social workers, and recreational therapists.
I hope you were able to enjoy our presentation on brain health. What makes Emerge in Neuro Rehab unique is that we offer a multidisciplinary and individualized approach to patients with neurological disorder, encompasses the whole body. Thank you and have a great day. If there's any questions or concerns, please reach Wendell Miller at emergenursingrehab.com or